let's say looking 10 years into the future, how do you see antibody therapies evolving? And then specifically, do you feel that people are looking towards human biology, like the way we're born, more as an answer to some of the problems that people experience?
I'll answer your questions in the opposite order. So the second question was, is there an appreciation for human biology as a blueprint for therapeutics?
Hmm.
The answer is certainly yes. COVID is a great example of that. And not just like the lay population realized the importance of mucosal immunity. There were some infusion and injection therapies that were launched and rapidly approved and then subsequently withdrawn that sought to deliver antibodies into the bloodstream because again, there's a history of delivering antibodies in that way. But it was well understood pretty early on that SARS-CoV-2, the virus that causes COVID-19, is a respiratory virus and is transmitted, from contact from respiratory droplets, things like this. And so antibodies in the circulating blood really don't migrate anatomically to the parts of the body that are actually infected with respiratory viruses, which is the nostrils, the nasal cavity, the airways, and potentially the lungs if the infection gets severe and it keeps migrating. So COVID-19 was certainly a wake-up call to the lay population, the general population, but also to the scientific community. Like if you just looked at the level of publications that were focused on mucosal biology and mucosal immunity, it really spiked during lockdown and because of SARS-CoV-2. So that's a clear example that the scientific and medical community do understand that like systemic immunity, which was such a focus for just the field of immunology, was not putting enough emphasis on mucosal immunology, which is different and involves different cells and it involves different parts of the anatomy.